Ladies and gentlemen, thank you for standing by. Welcome to the Foundation for a Healthy Kentucky fundraising webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you are on the phones and you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Wednesday, June 4th, 2014. I would now like to turn the conference over to Rochelle Seeger. Please go ahead.
Thank you so much. Good afternoon, everyone. Thank you for joining us on our call today. My name is Rochelle Seeger. I'm the Community Health Research Officer here at the Foundation for a Healthy Kentucky. This webinar is part of the Foundation's Health for a Change training series. This free series is comprised of webinars, in-person workshops, designed to support the efforts of Kentucky's community health coalitions, agencies, health advocates, and interested community members. Welcome to our webinar today. The Foundation for a Healthy Kentucky was founded in 2001 with a mission to address the unmet health care needs of Kentuckians with three main focus areas. Promoting responsive health policy aims to make public health policy more responsive to the health and health care needs of the people of Kentucky. Investing in Kentucky's future aims to improve the health of Kentucky's children by engaging communities in testing innovative strategies. And finally, supporting communities aims to support implementation or expansion of strategies to improve the health of Kentucky's lower-income communities. The Foundation does this by grant-making, supporting targeted health and healthcare-related research, and providing policymakers the information they need to make decisions which impact the health of all Kentuckians, and by offering training and technical assistance through events just like this one. Thank you for joining us. I want to direct you to the Foundation's website, healthy-ky.org. On our website, you'll find lots of information, including our data issue briefs, our reports, and also you'll find all the archives of past Health for a Change training webinars. Also, our upcoming events scheduled are posted on our website. On today's webinar, I'm honored to introduce 4 community leaders here at Work in Kentucky doing just what we promised on the webinar, raising funds for their projects at work to help the health of Kentuckians. They will share with us how they are developing partnerships, identifying matching funds to grow and sustain their programs. As the moderator mentioned, you can submit your questions via the chat feature on your website. I'm honored to introduce to you this morning Dr. Susan Zepeda, the CEO for the Foundation for a Healthy Kentucky. Before joining the Foundation in 2005, she was the first CEO and the Health Care Foundation of Orange County, and prior to that, she served as a director for the San Luis Obispo, California Health Agency and the CEO for that county's General Hospital. Dr. Zepeda is a member of the boards of the Southeastern Council Foundations and Grant Makers for Effective Organization. It's my honor to introduce to you Dr. Susan Zepeda.
Thanks so much, Rochelle. This is Susan Zepeda. I apologize for a frog in my voice in advance. I have those seasonal allergies. And speaking of seasons, Rochelle has arranged for a series of slides that show the changing seasons. Partly that's a way of reminding us when you get a grant, there's a wonderful feeling of elation, soon followed by, oh my gosh, I really have to do this stuff that I said I would do in the grant. For investing in Kentucky's future grantees, there was the further awareness that at the end of their planning period, they would have to find matching funds, funding partners who would help them in the next stage of their journey in the implementation of the projects their community decided to embrace to help Kentucky children grow up healthier than their parents are. We hoped in developing a planning period that preceded the implementation phase that this might be an opportunity to engage community civic leaders in the good work that you were intending to do for your community, in the hopes that some of them, frankly, might open their wallets and bring resources to bear to the projects that they, along with the rest of the health coalitions in each of the Investing in Kentucky's Future community, had identified as priority ways to make positive community change. So when you first learned that you had to find match, it certainly felt like winter. But then as you start to look around, we always are reminded in the world of philanthropy that grants from foundations, are actually a very modest portion of the total funds that nonprofit entities have to support their work. Most of the funding, the day in, day out funding that supports nonprofits, frankly, whether it's universities and hospitals or whether it's small community nonprofits, comes from people who love the work that you do and who embrace your mission. So the struggle is how to tell those folks who would love you if they knew you, where to find you and what you're doing. So let's move to springtime, when we're full of hope and forming those new relationships. One of the things that's a particular challenge in the coalitions that are doing the important work of investing in Kentucky's future is that some of them around the table may be governmental entities quite properly, school districts, health departments. Some of them may be nonprofits who seek and maintain donor relationships in their own right and may be struggling with how to share those donors with the good work that they're embracing through the coalition's identified health priority. So as we thought about how to till this soil in the hot summer of ideas, we realized that actually here in Kentucky, there are grantees that have plowed this ground before you, and those are the grantees of the Kentucky Healthy Futures Initiative. As some of you may know, the Kentucky Healthy Futures Initiative is Kentucky's play on the national arena of the Federal Social Innovation Fund. The Social Innovation Fund did not permit Kentucky grantees or any grantees around the nation to have the planning period that investing in Kentucky's future enjoyed, because for political reasons they wanted to get money out in the communities very fast to tell Congress the good work that was being done. Also, the Federal Social Innovation Fund, in addition to requiring that the foundation match those federal dollars 1-to-1, then required the recipient communities to match that total gift, half federal money, half foundation money, dollar for dollar from their local community. And so today we hope to reap the harvest of the work that these Kentucky Healthy Futures pioneers have done, because they have, in each community, reached out to find funding partners. In some cases, they were foundations, hospital foundations, that stepped up. But the particular grantees who will be speaking to you in today's panel were ones who found their donor support individual by individual, corporation by corporation. Some of them had a facility they could walk through and share the vision with the new grantees, but one of them, Mead Activity Center, was selling a dream that didn't yet have a physical plant to reflect its good work. So we're sure there's a lot you can learn from these presenters. And presenters, we hope that as you speak about the good work that you've done and how you've cultivated those donors and won them over to your cause, you might bear in mind the additional challenge that the coalitions who are listening to you have, that in most cases they don't yet have a physical plant to show to the donors. And in most cases they're grappling with how these many community organizations might come together to collectively seek donor support for their vision of a healthier community.
Thanks so much, Dr. Zepeda. And on our call today, we not only are setting the stage with some beautiful Kentucky scenery and the stunning seasons that we have here in Kentucky, but it really is the people of Kentucky that makes it such a fantastic state. I'm honored to introduce to you the first presenter from the Home of the Innocents. Leading that team is Steve Williams. He is the Associate Director for Research Development at the Home of the Innocents. Home of the Innocents opened a dental clinic at its interdisciplinary Hawkins-Smith Pediatric Assessment Center, the Open Arms Clinic. The program provides dental services to children in state care, children with special health care needs, and other children and families served by the Home of the Innocents here in Louisville. Thank you for joining us, and welcome Jean, the first member of the Home of the Innocents team.
Hi, and thank you for having us today. And I enjoyed the seasons to kind of demonstrate our journey. I'm Jean O'Brien. I'm Vice President of Outpatient Medical Services here at the Home of the Innocents. Our services is under Open Arms Children's Health Dental Services. And as she was stating, we do provide care for exceptional health care needs for children that we specialize in serving children in foster care, children with special medical and behavioral needs, and low-income families. We usually serve children such as we're a medical site for the refugee population, and we're also serving children from residential care, our residential facilities that are here on the property, along with other facilities such as Boys Haven. We have sort of what we call one-stop shop here in Open Arms Children's Health that has medical, dental, hearing, vision, radiology, and behavioral health all under one roof. We have an on-site pharmacy for the convenience of the patients so they don't have to stop on the way home to get their medications. With the funding from the Foundation of Healthy Kentucky and the Social Innovation Fund, we were able to partner with the University of Louisville School of Dentistry Pediatric Dental Program. And before we had this service and this collaboration, we did have a partnership with U of L where the residents basically just came over and saw our residents at the bedside and brushed their teeth. With this new state-of-the-art dental services, the children are able to be actually brought to a dental area and do more extensive work. Our goal was to improve oral health access to underserved children, to improve the pediatric oral health outcomes, and to improve dental training curriculum for the future oral health care providers.
This is Steve Williams, and unlike the title, what I really do for Home of the Innocents is write grants. So a large part of my focus for this project for us was helping to secure the match funding. And we used a very variety approach. We really started on using our existing relationships in order to identify and secure matching funds. The WHS Crusade for Children was a particularly essential relationship that gave us funding to help us actually be eligible to apply, and then we were also able to use grant dollars from the Gaines Foundation and a considerable amount of individual donor contributions. The strategy with each of these has been a little bit different, but I think that as you look at securing match in the future, building on those existing relationships, possibly through board members and the people that they know can help you connect with foundations, but then helping the public know about our services and telling them the stories of the children we were serving was particularly instrumental in helping us raise the donor dollars that were so important in this project. The very large part of our match did come through the managed care organization reimbursements that was provided through the CARE. But knowing the relationships and having multiple strategies for securing match is always particularly important. Being able to use things like here in Kentucky, the Center for Nonprofit Excellence is a group that can help sometimes in identifying potential funders, or groups like GuideStar and knowing how to locate the foundations that are funding in Kentucky. We're always willing to help if more information is needed regarding that. And Jean and I can both be contacted here. If others after the call today want to get in touch with us, we're happy to be available.
Great. Thanks so much, Steve and Jean. Your clinic is extremely impressive over there, a beautiful facility, and really meeting a need in the community that was before unmet. So I want to turn the call over now to the fantastic team at Hope Health Clinic. Hope Health Clinic has really built something new. The director there, Marcia Biven, is the Assistant Vice President at Baptist Health LaGrange. The Oldham County Health Department established the Hope Health Clinic as a free, low-cost clinic for the uninsured to serve Carroll, Henry, Oldham, and Trimble counties. The clinic provides acute medical care, chronic disease management, and patient navigation. Key partners in the Hope Health Clinic include Oldham County Ministerial Association and Baptist East Hospital. Thank you for joining us, and welcome, Marcia. Marcia, if you would check your line to make sure you're unmuted so that we can hear you on the call. Well, no, I'm glad you're here. Go ahead.
Sorry. I think it's important to reflect what happened at the very beginning of our formation, because that shows the importance that we found in building community support. There was a clinic that existed before Hope Clinic in our county, in Oldham County. It unfortunately was not able to survive. It was in existence for 5 years because of lack of funding, and it wasn't really well known in our county. So the hospital that I work at, we realized that there still was a great need in the county. So I got with our administrator at the time, and we decided to invite the community leaders that we knew through our connections with the hospital to a couple of dinners. We had 2 dinners in January of 2011, and we had about 80 people that came. And our purpose for those meetings was to share the data about the need, that there were uninsured people in all of our counties, and then to ask the very important question, would this community support another clinic? And we got a very positive response, and from that we developed a task force that was made of a collaboration of many different groups in our community. There were people from the faith-based communities, local government, the health department, and other concerned citizens. And from that, we started working toward our goal, which was a very aggressive goal, of opening a clinic in September of 2011 and deciding what kind of model of care we needed. So one of the great things about this collaborative approach is that our ownership came from the Oldham County Ministerial Association, which is an association of ministers in our county, and they stepped forward to say that they would form the 501c3 that would own the clinic. And so from that, we formed an advisory board made up of several of the task force members. The hospital donated the space, which is on our campus, for the clinic, and so the goal of fundraising began, again with a diverse approach in the community. We also, during the very busy summer preparing for the clinic to start, we found out about the Foundation for Healthy Kentucky grant, applied for that grant, and in order to apply for that grant, we needed to figure out who would fiscally administrate it. We had already had a strong relationship with the Oldham County Health Department, and so they became the fiscal agents once we were granted that grant, and that collaboration has continued and is very strong. So we began again to get the vision together, and in September of 2011, the Hope Health Clinic opened for patients. So one of the things I think we've learned that is very important in fundraising is the power of the word match, or the fact that, if you have a match challenge, that sometimes that is the impetus for people to give. Before we even got the foundation grant, our local United Way in Oldham County, who had been involved in planning of the clinic, put forward $20,000 and stated that they would give that to the clinic if there was a community match of the $20,000. At one of the task force meetings early on, we brought this message, and within 5 minutes, the judge executive of Oldham County stood up and said that the county was going to give $10,000, and the mayor, not to be outdone, stood up and said they were going to give $10,000. So right off the bat, we had $40,000, which really served to give us hope and impetus to go forward. And then, of course, we got the the Healthy Kentucky grant and the word match that we are getting this grant because of we're getting $100,000 infused into our county, but we will not, receive that unless we get the match. So that was really helpful. We had a large gift from a local church because of our need for a match with the foundation grant. Some of the things we've learned over the 3 years, which is a lot, we had several of our founding members, thought that it would be easy enough to get 1,000 people in Oldham County to donate $100 each, and that would give us the $100,000 match every year. And they organized a campaign to do that. We got some success from that, but it was a mail campaign, and we didn't get a whole lot from that. And so it became evident early on that we were not going to be able to depend on just individuals, that we had to have a multifaceted approach to fundraising. We've learned that we need to have, and we are developing a good board engagement because it is your board that goes out and is your voice in the community. We have learned that we need an active fundraising strategy. We have not developed that fully yet, but we are working on that because we feel that's important, as important as having a strategic plan. And we are learning especially from our recent session with the foundation, that incorporating storytelling and how to do that effectively will help us in raising funds. And now I'm going to turn over to Janet Warren, who is our administrator of the Hope Health Clinic.
Thank you, Marcia. We also have learned that we need to develop multiple storytellers. It can't be one or two individuals from our organization who hold all of the stories, but develop our board, develop our volunteers to be able to share that story as they move in and about through our community. And that has gone a long way to help us develop individual developers. We're still working on, individual donors. We're still working on that, but are increasing our efforts in that area. And we've also learned to develop a story that's particular to the audience that we're addressing. What might work for a Rotary Club is not maybe as relevant in the faith-based community where we may be sharing inside of a local church or in a business, etc. As Marcia stated, we had a strong influence from the faith-based community, and we learned a lot from that. They're great supporters with volunteers. Most of the volunteer individuals in our clinic all come from local churches. But we didn't see the dollars following the volunteers, so we had to back up and look, how do we tap into that market? We, in the beginning, used a blanket approach where we thought the same message went to all churches, but we've learned it's got to be an appeal to one church at a time, and an appeal that resonates with the culture and the interest of that particular church that we are speaking with. Another key piece of what we have learned is identify and keep at our fingertips where is our funding coming from. And this is a sampling of where all of our funding comes, with the top percentage at this time being our grants and so forth. But the second piece that we have felt very good about is that our patient visits, which are $10, and they pay a small amount for their lab fees, comprises the second highest area of giving, and that shows us the engagement our patients have in their medical care. We have found without that engagement that we don't have a full, we're not able to fully work with the patient. We have prided ourselves on taking a holistic approach to patient care, and it not just being just mental, but the physical, the emotional, and the spiritual. And when we see this engagement from our patients, we know that we are having success in that area and their buy-in into the care that they are getting. But this also has showed us areas where we need to work. And in our particular community and communities that we serve, we know we need to be working closer with engaging the businesses where our employees are primarily employed in supporting and being participants in the clinic with their funding sources. As I mentioned, where we've done well is patients. We've also had to dispel the myth that healthcare is now available for everyone, because that was a negative connotation that we had to overcome for beginning with the ACA, the first of this year. And we're all learning as time goes by that not everybody is going to have care, or they're not going to have access to care. They may have the policy, but with a high deductible, they still don't have access. So continuing an ongoing knowledge and education of our donors helps us to be able to increase and continue those funding streams. Over the next 5 years, we know it's just as critical to develop a strategic financial plan that includes both capital and operating, as well as developing a strategic operational plan. We are in the process of teaching our board how to ask. That has been a new opportunity for us as we have looked back over the last 3 years, and we say at Hope Clinic, we never started out walking, we entered a marathon. And then we're also expanding navigation systems for our patients to create an awareness within the community of what Hope Clinic does and the needs of the individuals. Therefore, we have additional funding sources and tap into interests of others in the communities where our patients live and work. We've learned if we can communicate our passion, that it will resonate with others, and we will see the compassion in the funding and the engagement within our clinic. And we thank you so much.
Marsha and Janet, thank you so much for a fantastic presentation. Really inspired us with that note of passion, because you're right, if we're traveling those Kentucky roads and only looking at the pavement, we aren't going to really see what's going on around us and see those fantastic opportunities, so thank you. Next, I want to introduce to our participants today, Aaron Greenwell. Aaron is the Executive Director of Meade County Activity Center. He oversees all the day-to-day operations and manages all aspects of Meade County Activity Center programming and special events. Aaron is a native of Meade County and a graduate of Meade County High School. He attended University of Kentucky, where he completed his bachelor's degree in business marketing and management. He spent a number of years with the YMCA of Central Kentucky, most recently in the position of Executive Director at the Scott County branch in Georgetown, Kentucky. Welcome, Aaron. We're so glad to have you on the call.
Thank you so much, Rochelle. I appreciate the opportunity. To start today, I wanted to just introduce a little bit about the Meade Activity Center and how the process took place, being involved with the COFI aspect of the Social Innovation Fund. So in 2008, roughly, a group of what turned out to be a lot of our initial board members here in the Meade County area were getting together and deciding very, very quickly that they had some very inherent needs and some gaps that needed to be bridged in our local community in regard to preventative health and making sure that there were opportunities for health, wellness, and recreation that were showing up as disparities here in our local area. So they came together and started to work as a group. It really is just, as it says here, a civic-minded group thinking about the betterment of our community. And prior to becoming a subgrantee of the Social Innovation Fund, our board was able to have a couple of events. They put on a couple of different programs that fit the mission of what they were all about, applied for 501c3 status, and we're able to start making some significant progress. However, the timing of the Social Innovation Fund could not have been any better for the Meade Activity Center than what it was. In 2011, the MAC was approved. I use the word MAC, I'm sorry, that's the acronym obviously for Meade Activity Center, as a subgrantee of the Social Innovation Fund. At the same time, the original board of directors, serving as really an operational board, was able to acquire a piece of property to serve as its potential new home. I like to use that picture there because I like to point out the relevance of the property that we were able to acquire. That is a picture of the part of the pool house at the outdoor pool that we were able to acquire in 2011. As most of you can see there from the detailed picture that was provided, it was dilapidated would be a soft word to describe it. At the same time, though, we saw the potential in how the facility that we were able to acquire in 2011 could fit into our long-term goals, and how it would allow us to immediately start doing some new programming as a result of the Social Innovation Fund and all the grants, all the funding that came from that. As a result of being funded through the Social Innovation Fund and the Foundation for a Healthy Kentucky, we were able to start new programs almost immediately. The initial work plan called for us to work specifically through an after-school program that was going to be focused around a national program called CATCH, which is Coordinated Approach to Children's Health. In August of 2011, I was actually formally hired as the executive director of the organization, and I saw an ability for us to do much more very quickly. So we entered into after-school programming in the fall of 2011, new youth sport opportunities, summer camps, swim lessons, and then later on became an affiliate of the First Tee. And I'll talk about these a little bit more in depth, but I think that the main thing is that we saw up front that from a standpoint of fundraising, we were in a little bit different scope of work than some of the other sub-grantees, but it did give us some advantages because we saw many avenues and buckets of revenue that we could potentially go after. Our whole goal as an organization was to create new programs, events, and access for our community and surrounding communities. So while we did see revenue opportunities available, we certainly operate all of our programs and events on a sliding scale for financial assistance to ensure that all of our area community members have access to programs regardless of their socioeconomic status. So, in that time, we've decided also, alongside many buckets of revenue, that we needed to make sure that we got together with as many local agencies that fit the same mission and needs as we would. I apologize, the slide that's showing now did get kind of jumbled around a little bit, but you'll be able to get the gist from it. We began to immediately collaborate with other agencies in our area, including the Central Kentucky United Way, Meade County Schools, our local Meade County Health Department, and Lincoln Trail Health District Health Department, the University of Kentucky Cooperative Extension located in Brandenburg, Kentucky, Communicare, the United States Tennis Association, the Todd Wagner Foundation, and the First Tee. By being involved with as many of these organizations as possible, it allowed us to gain a little bit more branding and credibility within our community, and ultimately would allow us a better opportunity to engage donors and produce revenue needed to make the match. In the early stages of 2012, we began to offer new youth sport opportunities in our area that weren't available previously. Some of these were available in surrounding areas such as Louisville, Kentucky, Elizabethtown, Kentucky, and Southern Indiana. But we began to offer youth basketball, volleyball, soccer, preschool sports, gymnastics, cheerleading, and other youth sports that were going to allow our local residents to not only engage in events that were unable previously in their local area, but also allow families who did need the subsidies that we were going to be able to provide the opportunity to participate, which was part of our mission from day one. As a result, we were able to collaborate with the Meade County school system and utilize a lot of their spaces along with other spaces provided by some of our collaborative agencies to be able to host these events. As I think Rochelle and Susan referenced earlier in the call, we do not, and still to this day, do not have the health and wellness facilities in place that we're needed to be able to host all of our events on our time when we'd like to. But as a result of so many good community partnerships, we were able to start these programs in 2012. In addition, we were able to become an affiliate of the First Tee. The First Tee is a national program focused around the game of golf. but truly really focusing more on core values such as honesty, respect, responsibility, judgment, sportsmanship, and others. The first T is located in various areas in our state of Kentucky. Our local field that we were able to partner with is out of Louisville, and that is hosted at Shawnee Golf Course in Louisville, Kentucky, and we were able to actually become an affiliate of the First Tee in the summer of 2012. Not only did that allow us to begin new programming focused around very much a lot of the same elements and core values that we focus on at the MAC Daily, but again, it was a great branding and marketing ploy for us from the standpoint that if we were able to become an affiliate of an agency as well known and well respected across the globe as the First Tee, then clearly it was going to give us a little bit of an upper hand in our local community as far as what we were going to be able to do in the long haul. In the summer of 2012, we were able to start new swim lessons thanks to lots of funding that was provided by local donors and through some of our fundraising endeavors to really give that pool that was shown earlier a major, major facelift and complete overhaul operationally and logistically. We were able to start water aerobics and fitness classes for our community members, and also swim lessons and other swim camps for children in the area. All of these became new programs that weren't available previously and contributed to our match through daily and weekly fees and or programmatic fees, although some of these were very much subsidized. And to that point, we had community members that were taking swim lessons for their child at the price of $10 for an entire session. Now, while that doesn't mean much to us in the long haul as far as match goes, as referenced by Janet earlier, the accountability of the community member making that small payment really does connect them to our agency and organization and allows them to feel like they're part of something. So that usually does go a really long way in terms of them staying connected with us through the future. In 2012, again, 2012 was our big year in programming. It not only allowed us to really get things started for the Mead Activity Center and for us to start to make a name for ourselves, but it also allowed us to start to build the revenue needed to make our match. We were able to do summer camps, and by summer camps, these were day camps that were offered throughout the 8 weeks in between the time that school released and the time that school started back. We offered a variety of camps, including swim camp, golf camp, visual arts camp. We had horseback riding camp off-site, and others included. But basically, it was a great opportunity where we had almost 350 children throughout the course of the summer participating in day camps, providing them a place to be surrounded by positive mentors and a place that their parents could feel that they could leave their children in a safe environment throughout the day. The Catch After School program was our first after-school offering that was part of the original plan for our COFI grantee process. The Catch program is offered completely free of charge in 14 different schools over 3 years and attributed to almost 375 total participants taking part in Catch, which was a twice-a-week after-school program offered throughout the community. This was a great way for us to give back as a result of all the grant funding that we received, and we received a lot of great feedback. I'm actually looking at a card sitting on my desk right now that came from students from Ekron Elementary thanking us for such a great opportunity this year. So the Catch program is kind of the springboard process for us and basically led us into all of our other programming that we were going to do. Throughout all of this, these are great revenue builders that we were able to create as a result of programming and special events. Other things that weren't mentioned in my slides thus far, such as 5K and 10K events, our annual triathlon, they contributed to more awareness in our community for what we were trying to accomplish. But there's no way that that's all going to get accomplished just with programs. Since 2011, we've hosted nearly 150 programs and special events focused on education, wellness, and recreation. We've taken a dilapidated facility and breathed new life into it and how it operates. Our facility that we were able to acquire in 2010 prior to us taking it over attributed nearly $3,700 in total guest fees received for the annual year. after taking our facility that we're currently with, we're able to take in over $3,700 in guest fees the last 2 weeks of May. So we've been able to properly use funding through the foundation and through the Social Innovation Fund, build the infrastructure, hire the proper staff, spread the word, do the proper marketing, and turn our facility that we currently have into a revenue builder, which has helped us make match, which has helped us build credibility and trust in the community, and helped us be able to go out and tell potential donors about our progress to date. We've hosted 5 Mike Matters galas in our local community with guests of honor including PGA golfer Kenny Perry, CBS anchorman Dan Rather, Eagles frontman Don Henley, Hall of Fame tennis legend Monica Seles, and I feel like I must mention entrepreneur and philanthropist Todd Wagner. Todd Wagner is part of the team that introduced Broadcast.com with fellow co-owner Mark Cuban, who most of you may know through the Dallas Mavericks or through the show Shark Tank. We are very fortunate that Todd just happened to marry a Meade County girl. Todd has been very, very influential into providing us opportunities and helping us build our agenda and curriculum and how we shape what we do at the Meade Activity Center. And it also helps when he can bring in A-list celebrities such as the ones referenced here for our annual gala. In the past year, after going through vast amounts of research and data collection, our Board of Directors has been actively coordinating a capital campaign towards a new facility that to date has raised right at $1 million in cash and pledges. We were not able to do this by simply walking out and asking for the money without the proper research and data to be going along with all that process. Our board worked very diligently on understanding what was going to be needed in telling the story, not just from where we started and where we're at this point, but as Janet and Marcia and everyone from the Hope Health, from Home of the Innocents referenced as well, you've got to be able to tell stories about the impact that your organization has made in your community, and more importantly, specifically to individuals' lives and families' lives and the impact that it continues to make. We spent vast amounts of time. Our board has been extremely burnt out to the breaking point, but they have put together many pieces of information that contribute to every solicitation they make when they go out and ask for donations towards our new facility that will make us sustainable over the long haul. They developed a business plan that showed the sustainable numbers and the long-term viability of the Meade Activity Center. And more importantly, they told stories about how children with special needs were able to participate in youth basketball, how a family on an annual income of $8,000 was able to send their children to summer camp all year, how a child who'd never picked up a golf club before was able to participate in the First Tee program or golf camp, and in turn end up with their own set of clubs provided by the Meade Activity Center so they could enjoy the game of golf for years to come. It's vital that numbers, pictures, and stories are going to be working together to be able to go out and make the ask in your local communities when it comes to fundraising. And more importantly, the person making the ask has got to be passionate about the community, about the project, and about the organization. And then just to finish up, a couple of quick pictures here. This is my absolutely elated wife on the right meeting Monica Seles before our 2013 gala. And then this is one of our board members' daughters with a signed copy of Don Henley's most recent individual CD that he had put out. And then finally, this is where we want to be. We're right in the middle of about 2/3 goal on our new facility that we hope to put in place by late 2014, early 2015. We have a campaign goal of about $1.5 million, and if our board of directors continues to pound the pavement and go out and make the ask with passion and with data to support it, I feel like that we're in a great position to be in a long-term sustainable building and able to control our own space and offer even more programs and events moving forward. All of this was made possible by funding through the Foundation for Healthy Kentucky and the Social Innovation Fund to springboard us into where we wanted to be. and then there's just a goofy picture of some of our kids from one of our camps this summer. So thank you for your time, and I appreciate the ability to present today.
Erin, thanks much. Thanks to all of our presenters telling very different stories about very different kinds of programs. But an underscoring theme is the passion, and I think Erin said it too. You've got to combine the compelling data with the stories and get all of your board members on board. In the case of the Investing in Kentucky's Future, all of your coalition members and their respective boards on board to, as you called it, pound the pavement. We have a little bit of time now for questions.
Sure. Erin, if you wouldn't mind joining in with one question. From some of our folks that have asked, you commented about your board being taxed and feeling, I don't remember the exact word you used, but feeling burnt out. How do you address that, and how did you rally them again to then go out back to do their work? Because that's a huge issue. People are tired of hearing no if that's where we are in the thick of things. So Erin, would you mind asking how you energize your board to continue their work?
I think there's a couple elements that come into play for that. Number one, when you start to put the pieces together, when you place a board of directors or a steering committee or various committees together, I think that the key is that you've got to have a couple of things to be a very valued board member: influence, affluence, and passion. And if you don't have two of the three, you're probably not going to be of much value to that organizational board. So I think that from the beginning, our board was put together very strategically and allowed us to have the right people in place that to do the tough grunt work that was going to take to make a startup successful. This is the best board that I've ever had the privilege of working alongside, and I worked alongside some good ones when I was with the YMCA. But I think that the main elements that would come into play are the 100% commitment from your board chair, which I have in our board chair, John Bevan, who basically works a second job by being the board chair for the Mead Activity Center. He is an insurance agent by trade, but really a MAC guy by the community standards. And secondly, I will take pride in saying that myself and our staff put in countless hours, and the sweat equity that goes into making the MAC successful. It makes it a whole lot easier for us to lean on our board a little bit. I think that leadership by example always goes a long way, and success also contributes. When you're able to do things and make successful ventures happen, it always re-energizes everybody from your staff to your board to your donors to everybody involved from the coalition members. And we've just really, I love that phrase earlier, we never started walking into this process, we entered a marathon. That's how I've felt since August of 2011. It's very tiring, but at the same time, if everybody's working together, when one loose end starts to fall off, somebody else picks them back up. And I think that our coalition, steering committee, board of directors, everybody has worked together to make sure that the motivation has stayed there even when the burnout factor starts to kick in.
Thanks, Erin. And speaking of the people that signed up for the marathon, Hope Health Clinic, I do have a question for you. I loved your story about being at that meeting where some of your community leaders started getting out their checkbooks. If you wouldn't mind sharing with us your response to that, were you ready for that, or was that a surprise to you? Just talk a little bit about that experience.
Well, this is Marcia. It was a surprise. I don't know if they had planned it ahead of time, the county judge and the mayor, because it was such rapid succession, or whether it was a competitive thing. I felt like if we put out there $20,000 to match from United Way, there would be some response, but that was a surprise. And really, that went such a long way to have $40,000 already toward already in our bank at the very beginning before we even opened was such a motivator for us. And I think it started the momentum that caused other people to say, well, if these people are going to give, or these organizations, then we're going to give.
I have a follow-on question because I know churches have really been a part of the Hope Clinic story. Say a little bit about how you get a particular church to give. Is it a second collection on certain Sundays, or individual members of the church? Say a bit more about that.
This is Janet speaking. What we have learned is to go and make the direct approach and ask for funding with churches is hard because churches get so many requests for funds for various missional opportunities and from various members. We've taken the approach to engage on a couple of fronts, engage their members in volunteering and serving in our clinic, and then go back and share with them how their members are affecting the community that we serve. And through that, we can ask them at that point, when they see that their actual congregation has a belief in what we're doing, we can ask them for funding streams or be a part of a monthly support. A great example was when just this past weekend we were at a local church and speaking, and we shared the story. We shared how it impacted very specifically, not by name, but an individual in our community, how the clinic had helped this single mom, and that we were there to help not only this single mom, but those people in sitting in front of us that we were speaking to, their children, their neighbors, their spouse, their mothers, their fathers. In the compelling piece of the story and what we had done, as soon as we finished speaking, that church immediately said, we want to take up an offering at the conclusion of the service. And then not only that, we want we want to be an ongoing piece of supporting you both with dollars and people. So we crafted what we said to meet the physical needs of the congregation there as far as what they resonate with in stories and their beliefs, and then it just led to a natural pathway of funding.
And this is Marcia. Just to add to that, we are owned by the Oldham County Ministerial Association, and there were some churches that put us in their budget, a few. That had been our hope, that more would put us in their budget. But I think Janet's approach is going to be what we're going to be using in the future for the churches.
One of our listeners today has asked a question about whether you have dedicated staff time, whether it's one person's job to either shepherd all these board members and community members who are out there seeking funds, or does somebody have a full-time fundraising job, or is it a piece of several people's jobs? If any of the speakers could respond to that.
I can respond from Hope Health Clinic because I am the only full-time employee at the clinic. I resonate a lot with Erin. We get to wear a lot of hats. We do not have a full-time fundraiser. It takes all of us being engaged. We talk with our volunteers. We talk with our part-time nurse practitioners. And they are part of the ones that set up some of the speaking engagements for us because they validate what we do. But no, we don't have someone mentoring. We are beginning to do that with our board, but we do not have a full-time person dedicated to that.
And Home of the Innocents team, would you mind responding to that? You do have a dedicated person, Steve, if I understand correctly, who's doing that work. But how do you expand that vision to make sure everyone who's working at Home of the Innocents understands the project and brings it out to the community so your message is spread? How do you all do that at Home of the Innocents?
It's a process that involves a number of us. In the development department, we do that through, of course, writing grants, but we do it collaboratively with our public relations and marketing person to help get the message out. One of the things that's been beneficial for us, I believe, is trying to get the word out to our potential customer patient base using things like bus shelter advertising. If we can grow our patient base, then that also helps us generate the revenue that we need. Getting the word out that way has been important, and just helping incorporate the stories from our Open Arms Children's Health into the various aspects of our fundraising, whether it's our social media or our newsletter or having events that focus on open arms and the health services. And Jean can jump in here as well with any comments that she has, but just trying to make sure that there's a multi-pronged approach of getting the information out to the public.
Well, the other piece that we do is we do a lot of community fairs. We're also going into some daycares and schools that have asked us to come in and just do oral health training and teaching. We've gone into some of the preschool classes and some of the daycares that are local.
It has helped to have a dentist who could juggle and has taken his juggling act out to the preschools to help the kids think it's cool to come see the dentist.
And I think what else helps helps bring out the dental project is that we're connected also to other services within the same building, and my staff are very aware of making known that we have a dental service that's right down the hallway if they choose to use that at the same time as they're coming for their medical or vision or some other services at the home. So the staff are very in tune in trying to educate the public about the services that we have on the property, which is very important to navigate patients.
Thanks so much. This is Rochelle again from the Foundation for a Healthy Kentucky. I can't thank our speakers enough. I think what they shared on this call today was their vision, their passion, and talking about their stories. I kept Aaron's kids up there from Meade County up there on the screen for a long time. They cracked me up, and sharing that inspiration is what's getting people to hopefully open up their checkbooks for our projects on doing the good work of working to improve the health care of Kentuckians. I want to thank you for being on the call. I'm glad you joined us today. Later this afternoon, you will receive an email with a link to the post-event evaluation. Please kindly just take a few moments to let us know what you thought about the event today, and also there's an opportunity to suggest future trainings. If your coalition is doing work and needs some additional training on a specific topic, please let us know. We'd be happy to incorporate that into a future Health for a Change training call. Finally, I want to let you know that coming up in September is the Foundation for a Healthy Kentucky's Boast Health Forum. The forum this year's theme is Doing Care Differently, A Journey to a Healthy Kentucky. That will happen in September in Louisville. Please mark your calendar for September 16th. Finally, I want to thank you all for your participation. I look forward to continuing our work on this journey down the beautiful Kentucky roads through each season and meeting you out there doing this work. Have a great afternoon.
Ladies and gentlemen, that does conclude today's conference call. We thank you for your participation and ask that you please disconnect your lines.